In the ongoing battle against COVID, the FDA is now meeting on whether to authorize booster shots for some recipients of the Moderna and J&J vaccines. Joining us now for more on this, physician at Stanford Children's Health, Dr. Alok Patel. Good to see you, Doc.
Good to see you, Kira.
Well, what do you expect to come out of the FDA's meeting on these boosters?
Kira, I don't think anyone would have ever expected these meetings to be so dramatic with such a hypothesis about what's going to be happening in there. But I honestly expect that there will be some type of approval for both the Moderna booster and the Johnson & Johnson booster. But it's going to be different because with Moderna, there is not as much data to suggest that the antibody levels are waning as much as they were with Pfizer or Johnson & Johnson. So there might be a more narrow kind of recommendation for Moderna, maybe high-risk people, definitely above 65, or people with underlying medical conditions, maybe not as broad. Johnson & Johnson is going to be interesting because there are some scientists out there who feel that it should have been a two-shot vaccine all along. So I do suspect that there will be kind of a recommendation more in line with Pfizer about getting a booster for Johnson & Johnson. But the mix and match study is going to add a little bit more dimension to all of this.
You know, a recent survey by the Kaiser Family Foundation shows that roughly equal share of Black, white, and Hispanic adult populations have had at least one vaccine dose. 70% of Black adults, 71% of white adults, and 73% of Hispanic adults. Now, with vaccines, when they first became available, as you know, the numbers for people of color weren't nearly as high as white adults. So what do you think changed? And what does this say about the racial gap in healthcare that we've talked a lot about?
The racial gap in healthcare that's existed for decades that is now getting a necessary spotlight put on it. But to go back to your question, Kira, I think two things have happened. The one that's pretty obvious is the access to vaccines, the infrastructure to make sure that they're going out to every community, high socioeconomic, low socioeconomic, everyone in between. That's obviously a given. But the more important thing that we really need to pay attention to is who the trusted communicators have been in these communities. Community leaders, church leaders, physicians, social workers, people on the ground level who are actually listening to concerns from the Black and brown communities and saying, hey, what is your specific question? Why don't you trust this? Because historically, there's been a lot of trust issues, rightfully so, from these communities. You can simply look back to the beginning of the pandemic, look at which communities were hit the hardest, but were given the least amount of resources to protect themselves. The communities where people didn't have access to testing weren't able to shelter in place because there were multiple family members in a small apartment. They weren't heard and they weren't spoken to. And I think that's been changing with vaccine education, and it's been showing. And I hope that this is a lesson that everyone has learned, and we do much better in the future when it comes to public health communication and reaching all Americans.
Now, earlier today, as you mentioned, President Biden did speak about COVID and the country's falling case numbers and with the country's overall fight against COVID. So are you optimistic about where we are as a country right now? And do you think that Delta was the country's last surge?
Well, I think now is the time for a little bit of optimism, but you know how we go. We have to be realistic. So we can't normalize the fact that there's still about 2,000 deaths a day. I do think right now, if you look at the surge that's happening from this current Delta wave, we're on the downtrend. That's a good thing. That's a combination of vaccination rates, also some natural immunity that does play a part, but also the fact that we're better now at actually catching COVID early and keeping people out of the hospital. One thing that, we can't ignore, though, is that there's still 70 million unvaccinated Americans, not only people who are eligible, but a lot of people who aren't eligible. And what the virus is going to do is continue to swirl around the country and try to find those weak points where there is not a high level of immunity and people can get infected. And we're seeing that happening right now in Alaska and some states such as Idaho and Wyoming who didn't see surges earlier. So that's what people need to be cognizant of, especially as we move to colder temperatures in the holidays when people want to fly back home and gather around and, just act like it's 2019. So we just need to be realistic here. Time for optimism, but also with a little bit of caution.
Got it. You mentioned the World Health Organization a little bit ago when we were talking about boosting. Now the WHO says that global COVID-related deaths are at its lowest levels in nearly a year. What do you think is affecting this reduction worldwide, even in places where vaccines are not still available?
I think it would come down to two of the three that I mentioned, because you're totally right. Vaccines aren't available everywhere. The amount of people who are fully vaccinated in sub-Saharan Africa, frankly, is pathetic in how low it is and how much better we could be doing. But I do think that there is some natural immunity that's having an effect here, but there's also, the worldwide collaboration and treatment and how to help people is also making a difference. It's hard to pinpoint. I don't have a great reason of why cases went down in places like India, which saw such a huge spike from the Delta variant, a lot of deaths, but not a really high level of vaccination afterwards. I mean, they're improving, but it's hard to say. What is known, though, is that there are parts of the country, and the world, I should say, where there is still a low level of vaccination, and we still have to keep our eye on them as the virus, I should say, still tries to travel around the globe. So as we talk about boosting and mixing and matching, I hope we still have as important, if not a more important discussion about worldwide vaccine distribution and the reality that without a booster, if you complete a full series, you still have incredible protection against hospitalization or death.
Dr. Alok Patel, new dad who is clearly getting still plenty of sleep because he has so much energy for us. Fight on. Thank you so much.
It's coffee.
I know, it's caffeine, right? Great to see you. Thanks so much.
Thank you.
And as you're watching that interview, we just learned, as we're going to take live pictures right now of that meeting we were talking about with the FDA, it looks like the independent FDA advisory panel just now voted unanimously to authorize Moderna COVID-19 vaccine boosters for Americans 65 and older, anyone 18 and older with underlying conditions, and those frequently exposed to the virus through work or home life. The recommendation is in line with what the FDA and the CDC have authorized for Pfizer booster shots, and that happened last month. So there you go. It happened in real time. We will continue to follow that meeting and bring you all the available information when it comes to boosters and our vaccines.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.